Hello, my name is Dr. Fong Nguyen, Medical Director at Redland Community Hospital Emergency Department. I'm also a practicing physician in the emergency department as well as the Medical Director for Redland's Fire Department. I'm here to explain the physician order for life-sustaining treatment sheet. This order is a vital important paper when a critical situation occurs with you or your loved one. We want you to make sure that your desire for resuscitation met when you are in a critical situation and are unable to tell us. The Polst will help me to know what level of treatment is appropriate for you or your loved one. Before you sign the Polst, you need to determine the quality of life versus the quantity of life. You also need to make sure that you are putting the patient desire first and not your own as the conservator for the patient. Knowing that in a critical situation, you might not make the right decision because of your emotional involvement. So the Polst will help you and us to follow the patient and your wish. I also want you and your loved one to discuss the Polst when you or your loved one still has the capacity to discuss about your desire for resuscitation. Resuscitation or do not resuscitate. The resuscitation including 3 critical procedures: intubation when you cannot breathe, cardiac medication when your heart stops, and chest compression to circulate the medication we just gave you. You need to do all 3 of them to have a successful resuscitation. When we only had to do 1 or 2 procedures, the outcome is not very good. So that's a critical decision you have to make prior for the situation arise. So you need to discuss with your physician if you decide that you only have 1 or 2 of the procedure done because it's going to change the way that we interact with you. So my encouragement is that you would do resuscitation or do not resuscitate. To check one of those boxes, and that I would know exactly what level of treatment would you like us to do.
Section A. Resuscitate versus do not resuscitate. Resuscitation includes chest compressions, or CPR, intubation, and cardiac medications, as well as defibrillation, which is an attempt to restart the heart through an electrical shock. If you check the resuscitation box, we will perform all of these actions as needed. If you check do not attempt resuscitation, we will not do CPR, place an artificial airway, or use cardiac medications. It is very difficult to revive any patient when only 1 or 2 of these procedures are done. Oxygen will not circulate without the heart pumping, and minimal oxygen will be delivered to the brain without mechanical ventilation through an artificial airway. Carefully discuss these options with your physician if your choice is to limit these interventions. Section B. Medical interventions. If you decide to check full resuscitation, you should also check the full treatment box. This way, we will do everything to resuscitate you in any way we can. If you decide to check the do not resuscitate box, you have 2 choices. Comfort measures only. This box will be checked if you feel that any treatments will only prolong you or your family members' suffering and you want nature to take its course. The patient's current quality of life should be taken into account. This box means that we will keep you or your loved one as comfortable as we can so they will not be in pain. Other than that, oxygen and IV fluids can be given for short-term treatment only. Unless you really have a desire to go to the hospital, the nursing home staff or home health care can make the patient comfortable and pain-free. Limited additional interventions. As with the comfort measures only, we will not intubate, do CPR, or give cardiac medications. These limited additional interventions will allow us to give IV fluids, more advanced airway treatment, as well as antibiotics. Again, the nursing home as well as home health care can achieve this level of treatment unless they have limited supply or trained staff. If so, the patient should be transferred to the hospital for treatment. Remember, transferring the sick patient from the nursing home to the hospital could be a stressful ordeal for the patient. Under this category, we need to discuss medications that may be needed to keep your blood pressure at an acceptable level after adequate fluid has been given. This would artificially raise the blood pressure until we can correct the underlying problem. You can write this on the Polst form under this section or additional orders. Unless you write this in, we will not treat the blood pressure with medications, but with fluid only. Section C. Artificially administered nutrition. If you want yourself or your loved one to take advantage of artificial nutrition, you can check the trial period of artificial nutrition or long-term artificial nutrition. You can always change your mind at any time to stop the feeding. If you do not want to have the artificial feeding, you should check the no artificial means of nutrition. Section D. Information and signatures. If you have an advance directive about your wishes when the critical time comes, it would be advantageous to transfer your wishes into a Polst form because all medical personnel accept the Polst. Also, the Polst requires a discussion with your physician so you can make an informed decision. The Polst form will not be honored by the paramedics as well as the emergency physician without your signature or your conservator's signature as well as your physician's signature.
Okay, well, doctor, let me see if I understand this. I will have a meeting with my family members, and after we've seen the video and I've looked this over, we decide if this is what I want. And then if I sign it, we get my physician to sign it also. So we have 3 copies. I'll have one. Susan, as my caregiver, will have one, and you, as my doctor, will have one.
Correct, yes.
I understand.
Yes. So that's good. Now, you know it's important for you to have this pulse at this time, even though you still sound-minded, your health is still good, even though it's declining, still good. But I think that it's hard when the bad situation occurs.
Right.
You know, and the
Yeah.
family member always have the emotion that they cannot make correctly for you.
I understand.
So if you have a good discussion, and with you being involved, I think it make it easier for the family.
The time to do it is when you're feeling good and you can make the decision that's right for you so that we're not doing this in a panic.
Right, I understand.
You know, we all should do one.
Yes,
Really.
very good. I hope this video helped you and your loved one to be informed and to have a great conversation when you are still able to communicate and have everyone on the same page when a critical situation occurs.
You know what? I'm so glad we took care of that for Mom today. But really, you and I should do a Polst as well. Look, they have a website. You can print the form right off the website. We should do it because do you want to put that burden on our boys? And really, even our boys should have one. Everybody should have one of any age. So look, you can get right online and print it. Let's work on it tonight.
Well, let's print it up and take a look.
Turn the TV off. This is more important.